Hello, everyone. Good morning. Good morning and welcome to today's webinar. We are going to begin in just a few short moments as you make your way into today's session. Today is the third webinar in the monthly series here for community supporting. Today is about the paradigm shift for county child welfare. In the meantime, as our friends come on into the room, I have a little icebreaker question for you. We all love a good icebreaker. Since we're talking about this idea of supporting, I had the question, which I'll ask you to drop into the chat. What song reminds you of friendship or support? What song is it for you that embodies friendship or supporting? What is it? I'm going to ask you to drop it into the chat this morning. Maybe I'm also looking for some karaoke ideas. I'm not sure. But if you have a song, Lean on Me, the Golden Girls theme song. Absolutely. Lean on Me, Stand by Me. You've Got a Friend in Me. Ooh, these are great. I'll Be There for You from Friends. Rainbow Connection. I'll Be There. What a Wonderful World. We Are Family. Wind Beneath My Wings. Thank you for saying that. I love that song. You're My Best Friend by Queen. Yeah, these are great. Bridge Over Troubled Water. Wilson Phillips, Hold On. Great song to sing in a car with friends, right? These are great. So today's question, today's icebreaker, as you're coming into today's session, into the Child Abuse Prevention Month webinar series. This is the third series. We're going to begin in just about a minute. We have 1 minute to go, and we're going to go until 12:30. But in the meantime, the question I asked you to answer to the chat is, what song reminds you of friendship and support? Some great ideas in here. Ain't No Mountain High Enough. These are great. If anybody remembers the Wonder Years theme song, Have a Little Help from My Friends, that would be mine. What About My Friends by TLC? Thank you for that. I love that. Great. Well, I'm going to try my best to start here in less than a minute, but I am really enjoying your responses here. Great. So we are just on a few seconds until we begin today's session. You can get settled and ready to be with us until 12:30 today. So I'm going to begin here shortly, and feel free to say hello and tell us where you're visiting from as well in the chat. I always love to see some names that I recognize, but for those that I don't, feel free to drop them into the chat and tell us where you're visiting from. All right. And while you're doing that, I want to officially welcome you to the third webinar in the Child Abuse Prevention Month series. My name is Jessica Matley. I'm a training coordinator with the California Training Institute, but you probably know us best as Caltrin. And I will be your host today. So I'm going to be just walking you through what to expect. And one of the things is the chat function, which is what you're doing right now. If you haven't had a chance already, please feel free to drop your name, your organization, bonus points if you let us know what county you're visiting from. We're excited to continue our discussions on the shift from mandated reporting to community supporting. As a reminder, shifting from mandating reporting to community supporting changes the mindset from when in doubt, report to how can I support. Today, we are joined by 3 county local level organizations who will share their work, their collaborative efforts, and innovative strategies that will help them move more towards community supporting. The organizations you'll be hearing from today have been invited to share the great work that they're doing in their communities in reducing entries into foster care, which exemplifies their investment in supporting children and families and moving more upstream and preventing child welfare involvement. We look forward to engaging with you on this topic and learning from our county presenters. If you'd advance me to the next slide, please, I'll give you a quick overview of what you can expect today. So what you should see on the screen here are very quick and to the point agenda. We're going to do just a little welcome, a little hi, how are you? And then you're going to be hearing from 3 counties, Humboldt, Tulare, and Ventura. And then, of course, at the end, we will have some opportunity for you to ask questions. And about that questions, as you can see, we're in a webinar format, which means that you are visiting, but we can't necessarily see you or talk to you. The best way for you to ask your questions are to use the Q&A function at the bottom of your screen. This will allow you to, or allow us to store questions that we will address at the end of the webinar if the questions weren't answered by the presenters throughout. Slides and the recording for this session will also be provided after the presentation. If you would advance me, please. What I'd like to do first is dive in and really go ahead and talk through these presentations. I want to start by introducing our first presenter from Humboldt County, Ivy Breen, with just a little bio, if you will, a little information about Ivy to get us started. So Ivy has been with Humboldt County Department of Health and Human Services since 2008, and in her current position as Deputy Branch Director for Child Welfare Services since 2018. Prior to her current role, Ivy oversaw the Humboldt County DHHS Research and Evaluation Unit, which conducts program evaluation for all the department's evidence-based programs. Ivy is currently the Deputy Branch Director over CWS's Continuous Quality Improvement Program, Workforce Development Program, Resource Family Approval Unit, Clerical Unit, and the CWS Records Unit. Ivy has a Bachelor's of Arts degree in economics from University of California, Santa Cruz. Prior to working for the County of Humboldt, Ivy worked in the private sector, including international work, where she specialized in managing by data with a focus on positive client and customer experiences and outcomes. And with that, I'll now turn it over to Ivy.
Hi, everybody. Thank you for having me here. This is definitely a privilege and a pleasure. Today, I'm going to be providing some information for you all about our journey, our county's journey on developing what is called a Child Protection Reporting Guide, an online tool for our community on making decisions about whether a family should be reported to Child Welfare Services or not. We've been on this journey for a while, and I'm going to provide some information on how we came about to developing a child protection reporting guide and what our process has been so far, and also provide some recommendations for those that might be considering developing something similar. So next slide. So just for some of the origins about how we came about to developing a child protection reporting guide, it actually came out of some complaints that had been lifted from our community members about how we were handling reports made at the hotline. And those complaints resulted in the Attorney General actually investigating our county. And part of that investigation included a data analysis on the reporting trends here in Humboldt County that was conducted by Evident Change. So they looked at our quantitative data on the volume of reports coming in, how many of those were evaluated out, how many of those met criteria for an in-person investigation. And they came up with a list of recommendations based on that data analysis. One of the recommendations was that the county develop an online mandated reporter guide. And at the conclusion of that investigation, the county and the Attorney General worked together on a stipulated judgment. So we came about agreeing to some corrective actions that our county was going to be doing over the course of the next 3 years, and that was in 2018. That corrective action plan was informed by the data analysis that had been done, as well as other general feedback that our county had been getting over the years. We had some grand jury investigations and reports that had come to us. We had conducted a review from NICWA, the National Indian Child Welfare Association. So there had been some recent system analysis done in our county, and all of that informed what had gone into our stipulated judgment. And so it really was a big system reform that we went through here in Humboldt County that began in February of 2018. And one of those was beginning to develop our child protection reporting guide. And again, that was one of over 30 requirements that we had in our stipulated judgment. So when we started that work, we contracted with Evident Change. I'm sure some of you are familiar with Evident Change, some of you might not be, but Evident Change was formerly the National Council on Crime and Delinquency, or NCCD, and they are the purveyors for the suite of tools that all child welfare counties use in California for those critical decision points in child welfare called structured decision making. So we contracted with Evident Change to develop our child protection reporting guide. Next slide. So just to highlight some of the data here in Humboldt County, we have a very high allegation rate per capita. It's quite a bit higher than the state of California. So as you can see here, our allegation rate per capita is 76.5 per 1,000 children, compared to 43.4 for the overall statewide rate. And then when we look at those reports that come in, we have a higher evaluate out rates. So 64% of the reports that came in 2020 did not meet the criteria for an in-person child welfare response. So those are reports where community had worries about a family, reported them to child welfare, and they did not meet criteria or the threshold for child welfare to send an investigator out. And that compares to 42% for the statewide rate. I think it's really important to also point out that our investigation rate per capita is still higher than the state of California. So we're getting a lot of reports, a lot higher reports per capita here in Humboldt County, but we are still investigating at a higher rate per capita than the state of California. So next slide. One of the other pieces that our data analysis looked at was our allegation rate disaggregated by ethnicity. And as you can see, we have a very disproportionate rate for our Native American and Black children here in Humboldt County. We have a very high rate of reports coming into us at the hotline, and so we really needed to explore, decision making and our community on how they're making reports regarding the children in our community as well. Next slide. So how did we go about? So as I mentioned, the development of what was originally called a mandated reporter guide, and we're now calling a child protection reporting guide, was one of the requirements in the stipulated judgment. And we needed to find a broad community group to help us develop this child protection reporting guide. So we had a standing meeting that we were calling the Community Task Force. So we had a quarterly meeting that was being held that was made up of representatives from several different disciplines. In the graphic is a Wordle that shows the types of agencies that were represented at our Community Task Force meetings. And that was the group that was tapped to be involved and help develop our child protection reporting guide. So we had behavioral health, education, tribes, family resource centers, medical providers. We had our other Department of Health and Human Services representatives there, social services. We also had law enforcement. We had our courts represented. So it was a nice diverse group that we were working with. And so we started the work of developing our child protection reporting guide within that setting of our community task force meeting. We also formed a subcommittee of that task force for those that were interested in being more actively involved in developing the child protection reporting guide. We did meet outside of the quarterly meetings with that subcommittee to develop our child protection reporting guide. And that work was really led and facilitated by Evident Change, who we had contracted with to develop this online tool. Next slide. So what is the purpose of a child protection reporting guide? The child protection reporting guide is really intended to expand that structured decision-making process to include that question about, should this family be reported to child welfare services, or are there other services that maybe this family would benefit from being connected to? The concept of doing structured decision-making, that process alone really encourages slow, methodical thinking rather than fast thinking. So when you use a structured decision-making process, you are avoiding that fast thinking, which often relies on intuition and can be influenced by emotion and bias. And by doing this more methodical, structured decision-making process, it encourages consistent, accurate, and equitable decision-making at the reporting level. So when we were seeing that really high reporting rate, and we're seeing disproportionate reports coming in within our community, just having a tool that allows the community to go through that slow thinking process. And using the structured decision-making process directs the user to focus on the most critical pieces of information for the decision at hand. And for our local child protection reporting guide, it is not intended to replace critical thinking. It is really intended to complement critical thinking and does not prohibit any reporter from making a report to the hotline. So the tool is just intended to be an optional guide. It's going to give the user some information about what the likelihood is if child welfare is going to send an investigator out. It is not intended to replace the hotline tool. It is really intended to identify that threshold for making that report. Is this child abuse? Should this be reported to Humboldt County Child Welfare Services or not? And again, if a user is using the tool and it says report not recommended, they can still call that in and make that report to Humboldt County Child Welfare Services. Next slide. So what is included in our child protection reporting guide? We know that families have complex needs, and so it really supports multiple multi-layered complex concerns. So it's structured in a way that has all of the different concerns that a community member might have about a family. So they're able to select multiple concerns. So if there's maybe domestic violence and substance use in the home, it doesn't limit them to one concern. It allows and supports multiple concerns about a family and walking the user through their concerns, each of those concerns that they have about the family. It is built in a way where there are definitions. So every question comes with a set of definitions about what it means to answer yes or no to those questions. And the final, once you work through all of the questions, it will provide a recommendation on whether the concern should be reported to Child Welfare Services. And if the concern, if there is a recommendation to report to Humboldt County Child Welfare Services, it provides the contact information as well as a link to the electronically fillable suspected child abuse and report form. And this is really the critical piece, one of the really wonderful pieces about the Child Protection Reporting Guide is that when a report is not recommended, it provides the user to other resources that have a spectrum of community-based resources available that the user could use to connect the family to those services. So it provides them to resource guides on available community services, whether that's domestic violence services, a family resource center, food boxes, those types of things they would have. And it's some of these resource guides are filterable. So you could search by region, you can search by need. So it provides those additional resources to the user as well. The online website also includes information on the Child Abuse and Neglect Reporting Act, what CANRA is, as well as some information on mandated reporting laws. It also provides information on contact information for our local jurisdiction, the law enforcement's here in Humboldt County. We've also been working on self-guided tutorials and training tools. It really is intended to be intuitive and user-friendly, but we're also working on developing tutorials so that users would be able to get some background information about what it's intended to do and how to use the tool, and we're embedding those within the website itself. We have created, this is a public, it is available to the public. And so really trying to get those training tools and information embedded in there so that folks that are interested in using it can do that on their own without waiting for a training to come up later on in the area. And next slide. So just, I won't be able to go into too much detail about what our process has been, but this, I'll just walk us through some of the major milestones that we went through for developing our tool. So as I mentioned, this started back in 2018. We had a kickoff meeting in September of 2018, and Evident Change came out to Humboldt County and provided a community orientation at one of our community task force meetings, and that was the first introduction to what an online mandated reporter guide or child protection reporting guide could do. We continued to provide concept demonstrations to our community. And then the work group started drafting our initial child protection reporting guide. Evident Change has worked with other jurisdictions. Mostly at that time, it was out of the country. They had developed some child protection reporting guides in other countries. And so they had some starter dough for us to work with, but we really developed a local tool for us here in Humboldt County that started with our community task force group. So once we had that initial draft concept developed, we were able to start some inter-rater or IRR, inter-rater reliability testing. And this is where we were able to test those definitions. So once we had the concept tool developed, we had some pilot users all get the same vignettes. So we came up with some mock vignettes. We had different users use the tool using that same set of vignettes to make sure that the definitions that we had developed in the child protection reporting guide were clear enough that different users would land on the same answers based on those same vignettes that they were working through. So that was the first level of testing that we did with Evident Change. We then moved to some field testing where users were able to run the tool through some real concerns that they had. And then we actually took some actual reports that had come into Humboldt County, both evaluated out and investigated, and used those real reports that we had received to test out the child protection reporting guide, and then made tweaks to make sure that the tool was working appropriately. We continued to provide community demonstrations and trainings, and included that at our task force meetings to get feedback on the continued development of the tool. In 2020, we started that analysis of those testing results so that we can do refinement, refine and keep tweaking the tool. In the fall of 2020, we had an initial version ready. We had a temporary platform. It was built in like Survey Gizmo, where it wasn't going to be the permanent functionality and user interface, but it had all of the definitions and all of the questions that were designed at that point. So we were able to pilot our interim tool and then start working on the training materials. And again, we really recognized that it needed to be, we needed to have some self-guided training tools, as well as plan to offer in-person and web-based trainings for our community. And then continued with those community demonstrations. In 2021, we transitioned to the permanent web platform. And so that is the current version of the website. It was moved to that permanent platform. And it was, that enabled us to make it a little bit more user-friendly and interactive. And then we were able to do user acceptance training, or UAT. And so we again looked for pilot users to give us feedback on their experience using the child protection reporting guide. And again, continued with community demonstrations at our community task force meetings. And all of the testing that we did and the feedback that we're getting from our community went into that further refinement. And then in 2022, we had our version 1.0 finalized. We continued to work on our training materials. That is something that we're still working on. And we'll probably, we'd be using our continuous quality improvement and different strategies to make sure that our training continues to evolve and improve. And then we included those community demonstrations. That's something that we did at several of our community task force meetings. And as I mentioned about how we came about developing this child protection reporting guide, it was included in that, that corrective action plan, that stipulated judgment that was about a lot of system reform that child welfare was going to be doing. And we really recognized that we needed a community partner to help us with this. This child protection reporting guide is a tool for the community. It's definitely a tool that child welfare staff can use when they also have concerns, but it's not a tool that is for child welfare services. It is a tool that is for our mandated reporter community and our community at large. And so we did a request for proposals to look for a partner agency to really help us roll this out and really help us with the implementation and sustainability of really getting this ingrained in our community and having our community comfortable with using the child protection reporting guide. We didn't get a viable proposal, so that's something we're still exploring and might be launching another request for proposals, but we're still looking for a partner agency to help us really implement this tool. And so now we're in 2023 and we are continuing to develop our training, and then we're really going to be pushing hard on our community outreach and getting this tool out to the community. I know every community is different, but here in Humboldt County, child welfare does, a pretty small portion of training to our mandated reporter community. I think we probably train, less than 5% of our community, not because we aren't available to do it, but because most mandated reporters have a mandated reporting training series through their employment. If it's a school-based mandated reporter, their risk management has their own mandated reporter training that they would be going through. I'm on the board for my daughter's swim team, and as a board member, I'm required to go through mandated reporter training, and I have to do that through USA Swimming's version of mandated reporter training. So really trying to have this tool be something that that there is online training tools available, knowing that child welfare won't be able to get the word out and get this, do all of the mandated reporter training for 100% of our mandated reporters. We're going to be continuing with our community demonstrations. We are building in ongoing evaluation around the user's experience and the tool itself, and anticipate doing further refinement down the road. Next slide. This is just a slide shot of the landing page for our child protection reporting guide. Just really giving folks an overview of what the purpose is before they get started on actually going through the questions based on their concerns. So this is just a slide showing what it looks like when a user lands on the homepage for the child protection reporting guide. Next page. And then this shows an example of how the questions are set up. So once somebody selects their concern and starts going through a series of questions, you can see this is an example of one of the questions in a series based on someone's concerns. And you'll see the definitions on the right-hand side. And it only shows half of it, but if you were to scroll down, and it would have definitions for the if the answer is no, what the definition for a no answer to that question would be as well. Next slide. So some of our recommendations. So since we've been on this journey, hindsight is 2020. Some of the things that we have learned is that we really, having this tool be a mechanism to connect families to prevention, entitlement, support services, and other programs as the driver is really, I think, in order to get buy-in from our community and have folks understand what the purpose is, really have it be a tool that will connect those who have concerns about a family to the right services, whether that's child welfare, whether that's a family resource center, but really having a strong mechanism for whatever the concern is, having the user be able to get that information about what a family needs based on their concerns. Building a tool that allows for structural supports for that warm handoff and connection to those services is really something that the tool would benefit from being able to do. Ideally, the lead agency would not be child welfare. As I mentioned, it's not a tool for child welfare to use in their daily practice. It's a tool for our mandated reporter community and the community at large. So really would benefit from having the lead agency be more of a prevention sector agency. You definitely need strong support from your prevention partners for launching this in your community. Definitely need commitment from the mandated reporter community at large to actually participate in the development of your local version of a child protection reporting guide. Definitely want to have readiness and buy-in from your community. Tribal consultation is really, really important. ICWA starts at the moment a call comes in to the child welfare hotline, and tribes, when you have a tool like this that is really looking at what are the right fits for families, just really being sure that your tribes are involved in the development of a tool like this. Identifying an agency early on to help support the implementation and sustainability of the tool, and then really thinking about evaluation and continuous quality improvement from the user's experience for a child protection reporting guide. Next slide. So there's my contact information. The link that you have there is a live version of our child protection reporting guide. So feel free to take a look. It does have an option for if you just want to try it out. If you don't have a real concern and you just want to test it out, you can go through the set of questions and test it out. So feel free to take a look. And so I'm going to hand it back to Jessica. Thanks, everybody.
Thank you. Thank you so much, Ivy. We just truly appreciate your insight and your overview of Humboldt County trends and how you're addressing this shift. You can even see those emojis popping up. We love those emojis. Thank you. So I'm now excited to shift over to Amanda Guajardo, who will provide an overview of Tulare County's Child Abuse Prevention Council's work as it relates to shifting to community supporting. Here's a little bit about Amanda. Amanda brings 30 years of experience working in the field of child development and parent education. Her deep experience, longtime involvement in Tulare County, and direct experiences working with the children and families of the Central Valley all drive her contagious passion for supporting the progression of prevention strategies and educational opportunities for all of our Tulare County communities. During her journey to CAPC, Amanda has served as an early childhood educator at the local and state level, a program manager, and an academic coach for state-funded preschools, and a service coordinator with Central Valley Regional Center. Amanda has also served as a parent educator for families with children with disabilities at the state and national level. Additionally, Amanda carries many training certificates and multiple years of experience disseminating child abuse prevention best practices through professional development presentations and trainings. With that, Amanda, please take it away.
Thank you, Jessica. You started by saying my 30 years of experience. I'm going to start by saying that I started when I was 10. That was because I just aged myself. But so thank you so much for the opportunity. 5 years ago, when I took the position in Tulare County to lead the CAPC, or the Child Abuse Prevention Council, one of the first things I noticed was that there were very few people outside of child welfare that knew what a CAPC was. And even more significant, no one knew what to do with me. And so I say that as a maybe call to action, or as a challenge for those of you that are viewing this webinar, is to learn about your CAPC, connect with your prevention council, and even more importantly, share the mission and the efforts. I feel our CAPC works very collaboratively with our whole community, with our tribal partners, and a lot of parent partner agencies. And the purpose of that was to communicate that that everybody was using the same language, that for preventing and abuse and neglect. So, and one of the other reasons that I feel that sharing the same language was really, really important for me as a CAPC leader is I knew I couldn't do this by myself. When I looked at the Welfare Institution Code and I looked at what I needed, I looked at was what was best practices. I thought, oh, there's no way that we can, as an organization with 2.5 paid employees, that we can do this work. So and again, we weren't being maybe invited to the table a lot. So from one of my, still continues to be one of my greatest mentors, said, you know what, Amanda, if CAPC is not being invited to the table, set your own. So we started to do that. And I really realized that that was going to be what was going to change the game for us. Next slide. So since collaboration was such, oh, next slide, sorry. So since collaboration was going to be such an important component of our work, we have increasingly focused on enhancing and relationship building with new partners, and maybe what you guys would consider uncommon partners. Many, and you'll see here on this slide, this is our, and I think I'm missing a few, this is who our members are of our Tulare County CAPC this year. In other words, these are organizations that have intentionally filled out an application and said, we want a voice at the table. We want to be part of strengthening families. We want to be part of promoting child well-being. We want to get there before a family gets into crisis mode. And as you can see, there's a variety of organizations here. And so we continue to expand those partnerships, even to sectors outside of social and human services, again, so that we can establish a common language and strategies that, help us improve that shared understanding. Right now, as I'm doing this webinar, one of our staff members is speaking at a Hispanic Chamber of Commerce right now to business owners. And because we really feel that no one likes to talk about child abuse, but it's everybody's responsibility. And so we want to make sure that even business owners, if you're a taxpayer, this is affecting you, right? So we really, really have partnered with a lot of what you may consider, uncommon partners, because we realized that we couldn't do this alone. Next slide. And so, when what we decided to do with our relationship with child welfare services is to be really, really proactive. And so, we're all talking about FFPSA and how it's going to bring our county significantly closer to implementing, a child and family well-being system. So this shift in culture really is requiring all of us to just really embrace a different mindset. And that needs to start with us, right? And it needs to start with child welfare services. So our Child Welfare Services Deputy Director, and she may be on this, Courtney Salam and I, we have intentionally set aside, we get together probably formally, maybe about every other month, to ensure, one, that we're supporting each other's work, that we're speaking the same language, and even more importantly, to show the community that we have a shared vision. We have found that by supporting each other, that it provides a model for equipping all of our diverse communities with the ability to offer support to each other, which is really the essential link to successfully bringing, FFPSA promising prevention policies into practice. So we do that. And I thought I'd put this slide up because it shows that, sometimes we just meet for breakfast and talk about how are you doing? Because it's just as important as what we do. And so Courtney and I make sure that we can't give what we don't have. And so we have decided that it is so important and so valuable for us to have that relationship that and it serves as a model for all of our other CAPC members, for our community members, that we do support each other and we are on the same team. And even though it's CAPC's vision to narrow that door to child welfare services, we can't do this without them. So we make it really a priority to show not only each other, but our community that we are supporting each other and that we are speaking the same language and that we do have a shared vision. And we like to eat. So what better way to do that? So, next slide. And so as a catalyst, CAPC, we really take the initiative to reach out to our child welfare services for data every month in order to determine where outreach is needed, where education and awareness efforts should be delivered. And so this information shows us it gives us an opportunity to maybe study trends and support direct service providers in those specific areas. So every month, when all of these partners that you saw on that slide come together for monthly CAPC meetings, we provide data that says everything from how many calls came into the hotline that month, what types of abuse are being reported, what all of the demographics, what ages of children are being reported more. And we do that by zip code, because we have found that as we look at those trends and as we share that and we partner with child welfare services to do that, we're able to see again, maybe some trends that are happening. Maybe we need to go do some mandated reporter training in an area where we're not getting a lot of calls. We would love to think that, there's no abuse or neglect happening in those areas, but realistically, we know that that's probably not the case. And so our child abuse hotline generally receives about, I would say maybe on average 800 referrals of alleged maltreatment each month. And these referrals, the majority of which are reported based primarily on the suspicion of neglect, that impacts hundreds of children. And more often than not, we're seeing, as well as the rest of the state, the general neglect cases are tied to poverty, including, lack of childcare, housing, basic, utilities, food, medical and legal support. And for this reason, we've made a lot of great strides on being part of the Tulare Child Development Council and offering various trainings to maybe early childhood educators monthly, to the Visalia Rescue Mission, Kauai Health and Family Healthcare Networks. They're all important partners for us because these neglect cases involve children at risk of maltreatment because of a lack of services. So such as, the treatment of a caregiver's behavioral health conditions or substance abuse, or services to protect a caregiver from domestic violence. These are all serious problems that are best addressed outside of the child welfare system. So we really, really value that partnership that we have with CWS to gather that data. Because of this, we also provide informational sessions to our HHSA different departments. For instance, our county mental health board, we meet with regularly, our county office of education, our behavioral health services, and even our Tule River tribal community. Because of our partnership with child welfare services, we've been able to build those relationships. Next slide. Our slogan or our motto, next slide, Jessica. Thank you. So our motto, our mission statement is every child safe, every community aware. And we chose that because it helps us to emphasize that our commitment to preventing abuse, but is to recognize that this is a collective responsibility to support all families. And so we have partnered with Child Welfare Services to offer, we do mandated reporter training for the county, and we partner with Child Welfare Services to do that. We have also, I feel like we were a little bit ahead of the game in terms of shifting this paradigm thinking to community supporting, because we also offer a training called Beyond the Mandated Reporter, and that emphasizes that community support piece. And so we offer those trainings in partnership with Child Welfare Services through our CBCAP funding to everyone in the community. And we do it at no cost to them. And one of the ways that we have intentionally partnered with Child Welfare Services is that we host an annual conference every year for about maybe about 300 attendees, many of which are our Child Welfare Service staff. And our partnership with them continues to grow through this because we offer CEUs through one of our 4-year universities here in it's Fresno Pacific, and I think Fresno State partners with us as well. So it keeps Child Welfare Services connected with us through a different lens, the prevention lens. Next slide. One of the other things that we really are proud of in Tulare County that has worked in partnership with Child Welfare Services is the LISA Project. The LISA Project is a multi-sensory exhibit about child abuse and neglect. Our target audience here is high schools. And so we try and take the LISA Project out to the high schools. We are currently this week, I'm in my office by myself because all of our staff is out at Exeter Union High School with the LISA Project. We partner with Child Welfare Services to bring this so that they are able to provide maybe some support, connecting victims with services. We invite Child Welfare Services to all of our showings of the LISA Project because and they have actually partnered with us so that their expectation is that all of their staff experience the LISA Project as part of their onboarding. We have lots of organizations in Tulare County that have made that commitment, that part of their mandated reporter training or their onboarding of new staff is experiencing the LISA Project. So we use Child Welfare Services to provide support at our events. It allows them, again, to see that prevention side of abuse and neglect, and to see, again, the importance and the impact that we have on the prevention side. Next slide. And as always, Child Welfare Services always supports us this month during our National Child Abuse Prevention Month, or what we refer to as our campaign month. You'll see here that when we do the proclamation, we include Child Welfare Services, our County Board of Supervisors, and youth, children, to read the actual proclamation at a countywide event. You'll see some of, again, what we call our uncommon partners. You'll see in the middle of the slide here a motorcycle group called Bikers Against Child Abuse, or BACA. They have turned out to be one of our best tree ribbon tires and they will lead our march on Main Street. We ask business owners, we ask community-based organizations to put lawn signs out in front of their organizations. So again, I think it's next slide. I wanted to end my time is to sharing with you again the membership, to remind you that our CAPC is very, very small, and we cannot meet the expectations of the Welfare Institution Code or the amazing manual, the best practices of CAPCs, or even align ourselves with the OCAP strategy plan if we didn't have active members. And if we didn't have that partnership with Child Welfare Services, we know that together we can do more. And again, you know, if you're not familiar with your CAPC or you're not an active member, it's just invaluable. The intentional work that we have done in the last 5 years, our CAPC has grown by over 300%. And, you know, when people see that there is really great things happening, and that you're visible, people want to be part of it. Again, child abuse isn't one of those things that people like to talk about, but again, we want to be there before a crisis happens. We love being able to identify that every family has a strength, and that we're all in this together, and that there's no shame in asking for help. The shame is when we don't ask for help and we continue to repeat that cycle. So we're really, really proud of the hard work that we've done to intentionally partner with common partners like Child Welfare Services and CASA, or even uncommon partners like our chambers of commerce or our city council members. So thank you so much for allowing us to share what we're really, really proud of. And I will just end by saying, if I can do this, anybody else can too. And so we're really, really excited about this new shift in paradigm of the work that we're doing. Thank you so much. Jessica, I'll turn it back over to you.
Thank you, Amanda. And I'm sure you'll start to see the emojis come across your screen. We all appreciate the work that you've shared with us today, and we recognize the important role that child abuse prevention councils have in implementing such efforts and engaging in this discussion. So thanks for sharing that contagious passion we heard about in your bio. Now I'd like to turn to our final county presenters representing Ventura County. That would be Laura Carmona and Salida Dabrowski. And, sorry, I have one more, Kathleen Van Antwerp. They'll be sharing about their county collective approach to this work. And we'll start with just a little information about each of them. Let's start with Laura. Laura Carmona is a senior program manager with Ventura County Human Services Agency, Department of Children and Family Services. She has a master's degree in social work and has worked in child welfare for over 22 years in direct practice, administration, and leadership roles. She seeks to build a child welfare agency that is intentional in its efforts to keep children safe by strengthening families, promoting reunification and family connections, and ensures equitable access to supports and services so that children and their families thrive. I'd also like to tell you a little bit about Salida Dabrowski, who is a Director of Public Health Nursing and MCAH Director for Ventura County Public Health. She has her master's in nursing administration and has worked in public health for over 18 years. She is also the board president for Ventura County's Child Abuse Prevention Council and is very active in the county's child, youth, and family wellness system development. Most of her career has been spent serving high-risk families and in family strengthening efforts. Salida's passion is to see all children and families thrive in a supportive and nurturing environment where they can reach their full potential. And we also have Kathleen. A little word about Kathleen Van Antwerp, who is the Executive Director of the Partnership for Safe Families and Communities, Ventura County's Child Abuse Prevention Council. Kathleen is a child mental health specialist and human developmentalist with over 30 years as a child and family advocate and activist. Kathleen leads organizations in strengthening community and family engagement through relationship-based leadership. Kathleen's work has been published in books and journals nationally and internationally. So Laura, I believe we'll begin with you. You can go ahead and unmute yourself. There you go.
Hi, good morning, everyone. Thank you, Jessica, and thank you, OCAP, for inviting Ventura County to participate in today's webinar to speak a little about what we're doing in our county. Next slide. So as we heard in the last webinar, understanding your county's data trends is really the first step in making the shift to community supporting and knowing where to focus your prevention efforts. As mentioned, I have worked for the child welfare system in our county, and so I am able to provide, or will be providing today, the county lens on how we are approaching this work. There are so many data points that you can evaluate, but there have been 4 primary points that have guided Ventura County in our efforts to improve our child welfare outcomes. And these are the 4 points that are most pertinent in today's discussion regarding community supporting and developing a community pathway infrastructure. All of these points have been the touchstone for developing our comprehensive prevention plan, which many counties are actively working on. Next slide. So the first 2 bullet points here really talk about our county's experience with disproportionality. The challenges that we have are really around 2 primary areas. The first is a geographical disproportionality, and the second is an ethnic disproportionality, and the 2 somewhat go hand in hand. So there are 3 primary zip codes in our county that generate about 40% of the child welfare cases in our county. And I do want to call out that these data are point in time numbers, but they are a reflection of the trends that we've had in our county for several years. And so for those of you that know Ventura County, these primary zip codes 93030, 93033, and 93036 are our South Oxnard areas. And this community is also has the highest representation of Latinx families in our community, as well as the highest concentration of poverty in our county. And so I think those points really come together as we will go through the presentation, and the link between the 3 that even some of the other presenters have made reference to today. A third point is really around our mandated reporters, and we were able to evaluate our data and determine that about 20% of our investigations are generated by calls from our educational partners, school teachers, personnel, teachers and school personnel. Often will call our hotline, concerned about some of their students' circumstances. Of those calls, 94% of those that have been assigned for investigation have been closed as unfounded or unsubstantiated, meaning that the worries that teachers have for their students has not traditionally met the legal threshold to be substantiated for abuse and neglect. Now, don't get me wrong, that doesn't mean that we have a community of overzealous educators. It just means that we have teachers that are worried about their students, and that as a county, as a child welfare system, we needed to find alternative for addressing these worries, because foster care and separating families is not always the answer. So in response to that, there are 2 child welfare programs that I want to highlight for you briefly today to address these trends, and I'll get to those in a minute. The final data point that I want to make reference to is that about 1/3 of Ventura County's child welfare foster care system are children ages 0 to 5. This group makes up the largest population of out-of-home placements in our county, and so it is one of our target populations for identifying prevention and early intervention efforts. And one of my co-presenters, Salita, will talk about a couple of our home visiting programs geared at this population for families in our community. Next slide. Okay, so Neighbors Together is a intentional effort that we developed as a department to respond to the disproportionality in those 3 zip codes. And this program includes staff that are assigned to emergency response, family preservation, ongoing case management. The primary objectives for Neighbors Together are, as referenced here on the slide, to address the disproportionality, both from the ethnic and the geographical perspective, but also to increase our partnerships with our community-based organization and partners, even informal partners in the community. Because as we were looking at the data, we also learned that this area is also very highly saturated with services, and that those services need some coordination and we needed to collaborate with partners to make sure that those services are delivered in the most effective way. We also wanted to redesign the child welfare services themselves. And this program is really a learning lab to develop best practice strategies for shifting the way that we are operating in these areas. We wanted the case management to be more culturally relevant and to provide services in a trauma-informed way. This program has been in effect in our county for about 5 years. And so on the right side of the slide, you'll see some of the outcomes we have achieved over the last 5 years. Overall in our county, we've had a decrease in our entries into child welfare, into foster care. However, our Neighbors Together program has had an even higher decrease in those numbers than our county overall. So our county overall has had a 39% drop, all zip codes in the county. But when we look at the 3 zip codes specifically in our Neighbors Together programs, they've had about a 49% drop. So we know that some of the strategies that are being implemented here are having the effect that we want them to. In addition to that, of those cases that are being opened in our Neighbors Together program, about 35% of them are family preservation cases. And so those are cases in which we are providing interventions and services to families in a intensive manner, and families are remaining together as a result. I could talk about our Neighbors Together program all day, but I don't have that much time. So I'm just going to call out 3 best practices that we have found the most success with. One is a cultivating solutions mapping. And essentially, this is a safety organized practice, safety mapping, with a twist. Essentially, it is a mapping that requires a cross-collaborative and collective approach. And so it is beyond the social worker and the supervisor, and it requires a social worker and supervisor from multiple programs so that we get the wider lens. We're also making attempts to have it be multidisciplinary and bringing some of our service providers and community-based organizations, cultural brokers to the table as we evaluate safety decisions related to children and families that are high risk. We also want this decision-making to be culturally sensitive and to really there is a point in that session where we are calling out and identifying cultural barriers and strengths and finding ways to make those opportunities, whether they're already strengths or whether they're barriers, but finding an opportunity to make those strengths in the families and also have those be considered as decision-making, as factors in our decision-making. The second is that we specifically have designed the units within this program to be teaming units. And so traditionally across our county, all of our units are designed by program. So you have a unit of emergency response, you have a unit of ongoing social workers. In this particular program, the units are teaming units that have a social worker assigned to each program within that unit. And so what this does is it allows for some opportunity to support transitions for those families that may be moving across the child welfare continuum. It provides continuity with the supervisor who will potentially be consulting and providing be part of the decision making with their ER worker, and then will follow the family as the case moves along to their ongoing worker or their family preservation worker. So there's that continuity of perspective. It also allows, our staff have provided feedback that it allows for their collaboration and knowledge sharing across programs. We have a relatively newer population to our staff, and many of which have 3 to 5 years of experience in child welfare, and so it really helps to expand their knowledge in how other programs operate and some of the decisions and factors that are considered. The third strategy is a pilot program that we developed with one of our department sisters, our benefits programs, and we have a dedicated employment specialist that is co-located with our child welfare social workers and Neighbors Together. And what this specialist's role is to help families in the child welfare system navigate the benefit programs to address the basic needs that they have. It is an effort to address some of the poverty-related issues, things like food, housing, job stability, things of that nature. And we know that poverty is, correlated with child abuse and neglect and can often be a barrier for reunification. And so this navigator helps to link with the child welfare social worker in providing these services. I also just want to mention that this program's been around for about 5 years and we'll continue to do some work there, but we are leveraging the success that we've seen in this program as we look at our comprehensive prevention plan rollout. We are starting in the Neighbors Together region for those efforts because of the established relationships that we've had. Next slide. Okay, and our Healthy Start program, as I mentioned earlier, one of the primary sources of reports to our hotline was our educational partners. And our Healthy Start program is a school-based program in which we have, it's a partnership with our Oxnard and elementary school districts, and we have child welfare social workers and case aides stationed at 6 school sites. I make the link back to Neighbors Together in that we have identified schools within the targeted zip codes to provide that partnership and that early intervention and prevention effort. While we are seeing a decrease and a reduction in the calls to the hotline from these schools, because social workers can address worries that are identified early on, and it's a response back to that high rate of unfounded reports. One of the biggest benefits that I think is important here is that we're building trust in the community through these efforts. We are shifting the community's perception of the role of child welfare. We're developing positive working relationships with the schools, with other community-based partners. And we know that schools are trusted places for families in the community. And so being able to be part of that relationship will really help us to build our infrastructure for a community pathway. And so the takeaway I leave you with today is that the community pathway and prevention efforts are important for being able to move towards the community supporting. You really have to invest in the relationships that you have in the community to be able to build a cohesive and comprehensive child and well-being system. And we are finding, significant success in that area. Next slide. And so the final data point that I referenced in the first slide earlier is that our children ages 0 to 5 is the largest population in Ventura County's foster care system. And so this is one of our targeted populations for prevention and early intervention. This is where I will hand off to Salita, one of my co-presenters, to talk about the county's home visiting programs.
Thank you, Laura. Good morning, everybody. Actually, good afternoon now. I'm so happy to be here to talk a little bit about our home visiting programs. And one of the things I somewhat joke about with our child welfare partners is that I am here to put them out of business. So that's what we want to do. We want to make sure that all of our kids can stay in their homes safe and that their parents are supported. So I'm going to talk about three. I'm going to talk about 3 different home visiting programs that we have in Ventura County. The first 2 being ones that are housed in public health. And then I'm going to share a little bit about one of our other programs that is through our first 5. Next slide. So not sure, hopefully a lot of you have heard of the Nurse Family Partnership Program. It is an evidence-based program. We were able to finally launch it here in Ventura County in April of 2020. So yes, right in the middle of COVID, we launched this brand new evidence-based program. But it's been growing ever since, and we're super excited about that. So we have public health nurses that support moms in having a healthy pregnancy and baby. We help with breastfeeding, nutrition, child development, safe sleep techniques, addressing maternal mental health issues. So all things that are considered primary prevention and really working to strengthen these families. So it is geared towards first-time low-income moms that are 28 weeks gestation or earlier. Right now, we have 9 public health nurses and 2 senior public health nurses that act as supervisors within the program, and we're hoping to continue to grow this. We've served about 190 families to date. Each nurse case manager is able to carry 25 families, and we actually see them from the pregnancy period up until the child's 2nd birthday. We have a really high retention rate already in Ventura County. We're at close to 80 to 85% of our families actually stay the entire length of the program. Those families that end up leaving our program earlier, most of the time it's because they've left the area. We have very few that just drop off and are lost to follow up. We're able to really provide linkages to community resources, which, as Laura was talking about, that's some of the basic needs that these families have. Is they need access to services. They have food insecurity. They have housing issues. They need support with finding and keeping a job. Just some of those basic things that we take for granted. Oftentimes, if we can get those services to these families to get them on their feet, then they're much stronger for it and able to provide that nurturing and safe environment for their kids. The other thing I'll say about our nurses in this program is the majority of them are bilingual, bicultural. So again, looking at the communities that Laura was talking about, we do have a high case, case count in those zip codes. And so it's very important that our nurses are able to provide that very culturally sensitive, culturally aware care for our clients. Next slide, please. The other program that we're very fortunate to have in public health is Parents as Teachers, which is another evidence-based program that we have parent educators, and we have 9 parent educators, and this 9 seems to be our lucky number right now. So we have 9 parent educators that work as parent educators, case managers in this program. Again, bilingual, bicultural, every single one of them, because that is a huge piece of the population that we serve. We did launch this program in April of 2019. We've actually served 404 families to date in this program. So we're, again, expanding and being able to serve many of our families this way. So we're serving families that can start in pregnancy and up until the child's 3rd birthday. There is an option to be able to serve children up until their 5th birthday, and that is a curriculum that we're looking to explore as well in Ventura County as we continue to grow. Again, providing linkages to community resources and services. Some of our funding for this program actually comes through the home visiting program through CalWorks. So we're able to provide some incentive. Actually, they're not called incentive items. I keep calling them that. They're really not, but we're able to provide items for the families. They get a stipend up to a certain amount that they're able to purchase things like clothes or, safety locks, safety items, play mats, toys, educational toys, things like that. So it really, it encourages the families to continue on with the services. And also in both of these programs, they really bond with their case manager. They're with them for a really long time, and they're seeing this case manager once a week, oftentimes, for a very long time, 2 to 3 years. So they really bond and build relationships with them. With this Parents as Teachers program as well, we have parent connection groups. So we're actually able to bring parents that are enrolled in the program together in a group setting. They're just starting to come back to in person. We were virtual for a really long time, obviously during COVID, but we're starting to get them back in person so that they can connect with one another. So that parents, we have this peer support that happens where they can support one another. They can celebrate with one another, be a shoulder for them to cry on. But we provide some education through those parent connect groups on different topics. So, the case managers each rotate and they provide these different monthly parent connect groups. Next slide, please. This program is brand new, just launched in February 2023. It was launched by our first 5 Ventura County, who's one of our very close partners in all of this family strengthening and child, youth, and family wellness system development work that we're doing here. They currently have 6 families enrolled. They provide 6 to 8 home visits with pregnant parents and new parents. They support the parents in bonding and playing with their infant. They also help provide connection and linkage to additional resources. And really what part of this is to transition families into the neighborhoods for learning, or resource centers and other community-based services as a warm handoff. They're also acting kind of as a filter for our Nurse Family Partnership and Parents as Teachers program. So if we have families that don't quite meet the criteria for one of our 2 evidence-based programs, then we can get them enrolled in Welcome Every Baby so that they can still participate and receive those benefits of home visiting. Let's see. They anticipate serving about 150 families annually once they reach capacity. So this is a very new project that we're excited to have in our community. They do use the Parents as Teachers curriculum. They're not up to fidelity. We're hoping maybe to get them there someday so that, you know, we have more of this evidence-based program work happening in our community. So we are excited to have all 3 of these really strong home visiting programs here in Ventura County as part of the prevention and early intervention work to target not only those 3 zip codes that Laura talked about, but our entire community. Again, our job, putting child welfare out of business. We want them to have no work to do. So as we move forward into the community supporting role here in Ventura County, this is a big part of what that's looking like for our families. So with that, I want to turn it over to Kathleen to talk to you a little bit about our Child Abuse Prevention Council work that we have going on there as well.
Thank you, Salita. And it's so exciting to be in community with all of you today and collaborating on the work that we're doing in all of our communities. And this panel represents the unified voice that we have here in Ventura County. It's so exciting. I'm Kathleen Van Antwerp. I'm the Executive Director of the Ventura County Child Abuse Prevention Council. Acronym is CAPC, as many of you know. And we go by the Partnership for Safe Families and Communities. You can bring the next slide. Today, we're excited to share 3 primary components of the work that we do to strengthen families and also to lead our child, youth, and family wellness system and help families understand that there are many opportunities to come together and to support each other and one another with the services that we provide. The 3 primary areas I'm going to highlight today are Strengthening Families Collaborative, our Parents' Voice, and our Mandated Reporter to Community Supporter Program. I want to highlight first that all of our programs are provided in dual languages. Everything has live Spanish interpretation and translation of all materials. And also with our Mixteco community, when they are invited and where they are available to come, we make sure that their language is also represented. So that's critical to the work that we're doing to strengthen families. The Strengthening Families Collaborative, the title alone is critical because we're emphasizing the fact that we are a collaborative and our primary objective is to strengthen families in our community. Our lead role, and we are responsible in this moment, is to link, lift, and leverage all the direct service agencies that we have in Ventura County. Sometimes people ask, what does that mean to link, lift, and leverage? Well, basically, we like to lift all of the different agencies to share resources, to celebrate one another, to talk about who we are and how we can connect and strengthen families. So we lift each other in the work that we're doing. We do this on a monthly basis. It happens on the first Wednesday of every month. And what's most exciting about our Link, Lift, and Leverage program is that we have cross-sector representation. So we generally have anywhere from 30 to sometimes 60 representatives every month that come from all the diverse direct service programs that we have. And not only do we lift each other, but we link. We talk about our direct services and how families can get directly connected. So it's how do we have a warm handoff? How do we have a family who is involved in our resource program or our resource to adopt program? We have representatives there to talk to each other. And so everyone leaves with information and knowledge on how to bring families and connect families. And then we also leverage, we talk about how do we share funding? How do we share educational resources? How do we share what's going on in the community and support one another? Every single month, we have an opportunity. Everyone unmutes themselves and says, hi, I'm representing this agency. And then we say, what's going on? Or we have an event coming up. We need volunteers, or we have a fundraiser, or we have grant opportunities. And how do we share that funding source to strengthen our family as a whole? Our Strengthening Families Collaborative is so informative and critical to the work we're doing in Ventura County. And it also is one of the core components of capacity building as we move toward this whole paradigm shift from mandated reporting to community supporting, because this really is a community coming together every single month. The other program we're very excited to share is our Parents' Voice. Our Parents' Voice, as you can see on the screen, is a diverse group of parents with lived experience that bring the voice and the lived excitement, information, knowledge base. Our parents are so authentically engaged. Our Parents' Voice meets on a monthly basis. We have a core of about 12 to 15 parents. And what we like to highlight is their lived experiences, not just with Child and Family Services, but all of the different direct service agencies. So we have parents to represent, come forward, talk about the strengths and the ways that these agencies have helped their families, but also the challenges that they've experienced. And then we take this information and our parents go back directly to different events in the community. We call them meaningful engagement opportunities. And our core team meets on a monthly and says, we have different agency organization events going on. How do we go to these meetings? How do we authentically sit at the table? How do we share our experience? And so our agencies are directly informed. Our parents, which is a very critical component, they are paid for their participation. And people often ask, how do we do this? Well, the monthly core parents come together and they're paid for their monthly participation. That group then creates quarterly social connection meetings for the larger community, where we invite all the families in the community to come, learn about resources, get trainings and workshops, and then also for their participation in other agencies' events. So for example, if Child and Family Services is having a meeting and they want to learn about a component of their agency with the input from parents with lived experience, our Parents' Voices will deploy, so to speak, or invite our parents to go to meaningful engagement opportunities, and then they're paid for their time. They're paid a stipend to participate. It's very exciting, and what we know is it continues to build and grow. And the more that families in the communities hear about an opportunity to sit at the table and share their experience, the pros and the cons, it really has helped inform and strengthen the systems and the services that we provide. And the third and final thing is our mandated reporter to community supporter, shifting in the work that we do. We provide quarterly mandated reporter to community supporter trainings, and then we provide them upon request as well. But what we've really started to do successfully in Ventura County is to incorporate the language around community supporting. And what we've done, and I think it's been very successful, is we've created and incorporated several interactive polls during our training so that we can gather relevant data from our community concerning their understanding of topics such as community supporter, reimagining child welfare system, adverse childhood experiences or environments, trauma-informed responses, critical need for self-care, community pathways, cultural humility. We always talk about the 5 protective factors, and of course, our child, youth, and family wellness system. So what we found in these workshops is if we divide the why into about 3 distinct parts, when participants come, they're expecting to learn about mandated reporting, but we open up our training by talking about the why behind a reimagined child welfare system. We share a lot of the information that was shared today about data and about the history and about how we have to really rethink the way that we're engaging families. So we open up with the why. We discuss the importance of understanding both the need for community supporters and trained mandated reporters. So we define the different types of child abuse and the technical aspects of reporting. But we make sure that everyone understands that our role and our responsibility is to figure out how do we help this family build upon their strengths and then support them in ways that will continue to help them grow. And then most importantly, we provide community pathway examples, and we encourage everyone in our workshops to envision how they can incorporate this new approach into their work in their own community. So we have found a lot of success in the paradigm shifting from mandated reporting to community supporting. And the 3 primary ways that the Child Abuse Prevention Council is building the capacity of this shift is through our Strengthening Families monthly meeting and our collaborative efforts and our cross-sector diverse representation, our Parents' Voice that are valued with authentic engagement, and then our mandated reporter to community supporter paradigm shift training. So it's just such a unique opportunity to be here today and share with you what we're doing in Ventura County. And of course, as always, we're more than happy to share and exchange ideas and information. Please reach out to us, and we are happy to join you in your efforts. Thank you. And I would like to hand it back over, I'm sorry, to Jessica.
Totally great. Thank you so much just to Laura, Salida, Kathleen for insight into the work your county and your organizations are doing and really spotlighting the need for collaborative efforts amongst all stakeholders to make this change to community supporting. And what I want to tell y'all on the call, so participants, we have about 7 minutes or so that we're going to focus in on Q&A. I've got 4 questions I'm going to address that were dropped into the Q&A feature. I believe we will run just a little bit over 12:30, so if you can hang out with us, that would be great. But I'll get started right away by asking the very first question. This question is going to be for you, Ivy. And the question is, I will read it right out for you. Do you have any appropriate services to connect to? Is there a way through this tool for reporters to find out about relevant services?
So yes, the tool does drop the user into, it gives multiple links. So we actually have a couple different portals here in Humboldt County that prevention sector agencies have put together that houses a huge array of all of the available services in the county. So it gives them a link to that separate website. We actually have like a static list. So there's one website that's more of like a PDF, like a static list of a bunch of the different services in Humboldt. And then there's a separate website that is actual like an interactive, filterable, searchable database of services. So it drops them into, it gives them the links to those 2 separate websites. One of the hopes and dreams for like version 2 or maybe version 3 is that there might even be like a referral form built into our child protection reporting guide. So if the user wants to make an actual referral to a family to other services, trying to think about how we can design like a universal referral form or some other referral form into that, but that we don't have that yet, but there has been some conversation about that.
Ivy, when you talk about the next iteration, I can really hear that continuous quality improvement background of yours coming through. So the second question we have for you is, how is the tool completed by mandated reporters since they are not urged to become investigators?
It's a really great question. And we definitely designed it to be a funnel. So it is not intended to replace the hotline tool. It is not intended to do the work of child welfare by deciding whether we screen in or out. It is designed to funnel more reports in to child welfare that would still be screened and would be evaluated out, but it really just begins that funnel process. We also know that child welfare might have additional information about a family. So it really does, it is intended to funnel some of the ones that are still going to be evaluated out into child welfare.
Wonderful. Thank you so much. And the next 2 questions I have are going to be for Ivy and possibly Brittany. Maybe one of y'all can jump in for it. The first question I have is, does Humboldt have pre and post data about, pre and post data they can share about how hotline calls changed after implementing the tool?
We're still in the infant stages. We really haven't seen a significant participation yet, but we are designing an evaluation plan to really try to do just that. What are we seeing fewer reports come in? Are we seeing the right reports come into child welfare? And really seeing a shift in, are we seeing more consistent and equitable reporting? Those are the things that we are going to be measuring. So maybe next time I come, I will be able to have data, but it's too early to say just yet.
Awesome. Thank you. And finally, I have, is there any connection between these community support models and plans of safe care?
I think that may have been a question.
That might be for you, Brittany. Brittany, I'm not sure if you caught the question. I can definitely repeat it. Or actually, I'm not sure Brittany's on the line. We'll double check. Okay, well, let me make a quick note because I know that we are here towards the end of our time together. The question I have is, or I guess the statement I'd like to make, of course, thank you to all the presenters, right? We are so grateful for your time, for sharing information with us today, and of course, to the participants. Thank you for being here. We're very excited to have you all join us for the final CAP month webinar, which is going to happen next Wednesday, April 26th. It'll be from 11 to 12, so 1 hour. You can find that link in the chat. It's been dropped for you. You can register by accessing that link. And the next webinar is titled Collective Perspectives to Community Supporting, a Call to Action, and will be an opportunity to engage with a large panel of professionals representing a wide range of sectors, including CalWorks, CalFresh, childcare, family resource centers, law enforcement, community organization professionals, quite a few people listed there. We will have a very robust panel, so please be sure to join and register. And lastly, of course, we'll be sending out all of the materials, the recording, and a brief questionnaire for the session today. We appreciate you completing the questionnaire to provide feedback on today's webinar. And with that, we want to say thank you all for being with us and have a wonderful week. We'll see you again.